Anyway, I'll kind of watch the participants, so I may look away once in a while, you guys, but gosh, thanks everybody for being on here. It's fabulous having you guys. We appreciate each and every one of you very much, of course. And we just love what we're doing here. We love being able to give people hope and encouragement and all of that stuff. And so we'll continue to do that. I would like to ask everybody that if you have a question, please raise your hands, or there's a hand thing that you can put on Zoom or whatever that helps us control things. It's only me running this. And so I like to do that so that we don't talk over one another and those kinds of things. It's going to happen occasionally, but if you can try to help me out with that, I'd really appreciate that. Last session, we had Steve Van Houten, and he talked about the peer support groups that are going on with SAO, and it's in Oregon right now. I realize that, but we're really looking forward to doing more of that because it's a one-on-one meeting with others who've had situations where they don't really want to come on a group Zoom meeting or something like this, and they can just have one-on-one conversations, which we do some of that, and that's awesome. And that is with Stroke Awareness Oregon. So again, it's more of an in-person thing. I would like to mention to everybody here, we are on a final push. We had a May campaign, and we're on a final push to raise funding for Stroke Awareness Oregon to continue to do what we do. We do so much out there. Gosh, it's almost hard to even say everything that we do, but May has been a huge event. Of course, we run all these stroke survivor meetings, and we'll talk more about that if there's time, if Dr. Coby finishes soon, but if not, we have we have young persons. We have 2 of these stroke survivor meetings each month. Alicia, who's on here, runs the young persons. Ralph, who's on here, runs a men's group. We have a caregiver group. So we have all of these groups, and we're really helping the community. And so we need funding once in a while to continue to do the good stuff that we do. And so we do ask, it is May, and in the chat box, if you guys want to look at that, or you can just go to strokeawarenessoregon.org and go to the donate box there. And if you feel so inclined or can, we would appreciate any kind of funding we could get from you that helps us continue to do what we're doing out here. And we appreciate you all so much, and we appreciate that very much. So thank you. If you get a chance, thank you so much for that. So we've been having a lot of people that you guys asked for, okay? Because we put out a couple of months ago, who do you guys want to hear from? And one of those people in particular was Dr. Coby Hanes. And he is in Prineville, Oregon. And excuse me while I got to keep watching for our participants, but I'm going to read Dr. Hanes' bio a little bit here. And first of all, he's going to talk about brain health today, and we're so thankful for you, Dr. Hanes. We really appreciate you coming on here. It means a lot to us. So Dr. Hanes specializes in the treatment of autoimmune disease and musculoskeletal. He might have to help me with some of that disorders. He is an IFM certified functional medicine physician and is certified in botanical medicine through the University of Colorado School of Pharmacy. He also participated in pharmacy from the rainforest, a 2-week educational voyage deep into the Amazon rainforest of Peru, where he studied with 2 of the world's leading scholars in botanical medicines, James Duke and Varro Tyler. Dr. Hanes has completed many postdoctoral programs, including mastering the thyroid, an intensive on mastering brain chemistry, and is involved in ongoing education in the advancements of functional neurology, functional medicine, cold wave laser treatment, and functional movement training. He also completed advanced clinical training in and recently became one of Oregon's first physicians to be certified in Dr. Dale's Pedersen's
Bredesen. Dr.
Okay.
Dale Bredesen.
Protocol for treating Alzheimer's. Just thank you so much, Dr. Hanes, for being on here and helping out the community. We appreciate you very much. And if you have slides or any of that, I'll give you access and we'll get going.
Okay, so I have to apologize in advance because usually any talk I do is about 2 hours long. So I I started whittling my slides down, but it says host disabled participant screen sharing.
Well, let me do it here. If I can figure it out, I'm sorry about that.
No worries.
You should be the host now.
Okay. Okay, hold on 1 second here. Not seeing my. Can y'all see that?
Yes.
Yes.
Okay. So, you know, I'm here to serve you guys, and I'm going to try and leave time for questioning. But you know, when I think about how do I serve my audience, this talk was kind of more structured towards neurodegeneration, so Alzheimer's and Parkinson's. So I'm going to kind of hit the highlights, but brain care, regardless of whether it's post-stroke or concussion or Alzheimer's or any kind of dementia, there are some of the same basic core root factors that we need to address. And, you know, I think it's one of all of our greatest fears as we age is that we lose our memory or our ability to think or communicate, that we might be a burden to our family or be confined to a nursing home, and just not feeling like a productive citizen. And I haven't had a stroke, so my heart goes out to all of you, because I can imagine, depending on how extensive the stroke was, that there can be some dark nights of the soul where you just, hey, wonder if, am I going to be a productive human being again like I once was? And I can only imagine the frustration in trying to go through some of that rehabilitation. So I'll kind of buzz through these, but you know, like I said, I will try and save time at the end for questions. So when we think about, let's see if it's going to cooperate with me here. There we go. When we think about why we're concerned with, and tell me, can you see this next slide?
Yes.
Yeah.
Okay, so it looks like they're advanced. Why are we concerned about brain health? Because really our central nervous system is what gives us the ability to remember our loved ones, remember our experiences shared with them, our ability to think, formulate ideas, our ability to appreciate and see sunsets, smell or enjoy flowers, hear beautiful music. These are all things we experience through our nervous system. And your unique ideas, thoughts, feelings, and experiences are what make you you. And if you don't have good brain health, you start losing that part of you. And it's not anything we would wish on our worst enemy. So a couple of things about and I'm going to pick on medicine just a little bit here. So I hope that doesn't offend anybody, but prescription drugs right now are the third leading cause of death in America. And when we look at this, we're not talking about you went in and you're on 5 or 6 drugs, and these are properly prescribed prescription medications. So you go into the doctor, you get the proper diagnosis, they put you on a medication or 2 or 3, and you die or have a serious adverse effect from it. So prescription medications, we are the most overdrugged society in the world. Americans, average American has at least one chronic health disease, and some as many as 4 to 5. Rates of cancer, diabetes, dementia, obesity are all rising at alarming rates. And Americans spend 2 to 3 times, some estimate up to 4 to 5 times any other country on healthcare, yet we rank 37th according to the World Health Organization, as far as where we rank as far as how we're taking care of our citizens. So we're not getting a great return on our investment. So why aren't doctors taking care of patients' brains? And I often joke that brain care is not part of medical or the alternative medicine paradigm, like chiropractors, naturopaths. It tends to be kind of a neck down approach. Even though the brain is one of the most sensitive organs in the body to inflammation, poor circulation, poor blood sugar regulation, and toxins. Even though it's the most sensitive to those things, the brain is also, if you do things right, is one of the easiest, I don't want to say easiest, it's fairly easy to rehabilitate it. The brain, as we've learned, is very good at what we call neuroplasticity, creating new pathways around areas that have been damaged. The problem is doctors are not trained to recognize the signs, or with dementia in particular, they're not recognized to see the signs early enough when things can be done. Like Alzheimer's, as Dr. Bredesen, who I trained with in his RECODE program, they have come up with a protocol that is very good at turning around Alzheimer's and many kinds of dementia, but not when you're down to where you're needing to go into long-term care facility. The earlier you catch it, the easier it is to reverse it. And one of the things Dr. Bredesen talks about is the brain, or Alzheimer's. Treating Alzheimer's is kind of like treating a roof with 36 holes in it. And he said the reason prescription medications have failed so miserably to be able to address dementia is because there's 36 holes in the roof, and these drugs are really good at plugging one hole, but you still have 35 holes in the roof. And his wife Dr. Bredesen is a brilliant man. He's probably published more on neurodegeneration and Alzheimer's than anybody on the planet. He's got over 250 scientific publications to his credit. He began the Buck Institute down in Los Angeles. Anyways, his protocol, his wife is a medical doctor, but she also went through functional medicine training. And so she's a functional medicine colleague. And functional medicine, for those of you who don't know that terminology or haven't heard of it, really is an intense diplomate program that really trains doctors how to really look upstream as far as they can to treat the root causes of complex chronic disease. And so she kept pestering Dr. Bredesen, saying, you really need to look at functional medicine and incorporate some of this into your rehabilitation programs. And so he did. And now he's published 3 or 4 papers on one case review of over 100 cases where with many different practitioners using his RECODE, which stands for Reversing Cognitive Decline protocol, where they not only see large improvement in the patient's neurocognitive ability, but also in their brain imaging. And there's no drug that has come out that has been able to do that. So when we talk about functional medicine and kind of how I approach these things, I just going to kind of throw some terms out there. Functional medicine really is a root cause resolution medicine. It's personalized. And the difference is when I meet with a patient for the first time, when I'm doing this kind of treatment, usually that first appointment is 2 hours long, because I want to understand their whole story about how they got to where they are. Because coming to the diagnosis really is just the beginning. Then you got to understand the complex mechanisms behind what's driving that disease and what's perpetuating it. So, and a lot of those things are diet and lifestyle factors or choices that contribute to about 90% of complex chronic disease. Mm-hmm. So the medical model, medicine is very good. In this country, we have the best emergency medical system on the planet. If I cut my arm off or if I'm dying of a myocardial infarction, there is no place on planet Earth that I would rather be than right here in the good old USA. The problem is we're terrible at complex chronic disease. And I kind of use the analogy that medicine and the way it's delivered in this country, it's like the fire department. And, you know, if they get there in time, they'll kick in the door and they'll come in with their axes and their fire hoses and they can save the structure. The problem is you don't call them back Monday morning to help you rebuild. You call a carpenter. And so a good functional medicine doctor is a good carpenter. They're there to help you rebuild the body from the inside out. So we're the best in the world at acute care. The problem is, the other big problem with medicine is they only have two tools in their tool bags, drugs and surgery, which are great for acute care medicine, but do not work well. And sadly, drugs and surgery failed 125 million Americans who suffer from complex chronic disease. Conditions like diabetes, obesity, cardiovascular disease, cancer, Alzheimer's, and autoimmune disease. These kind of complex chronic diseases, there is not going to be a medication that's going to fix these. You have to look at diet and lifestyle. And what I tell my patients is there is no drug, there is no supplement, no surgery or magic potion that will outdo an inflammatory diet and lifestyle. And I pull no punches. When they come to work with me, I say, you know, if you're not willing to jump into the deep end and do your part with diet and lifestyle, don't waste your money and my time, because I can't help you. Because I will partner with you, but I don't want anybody coming and plugging their umbilical cord in to me thinking I'm going to save them, because that's not good medicine. The best doctor in the world is, doctor means educator. And my job is to educate my patients how not to need me. And I can do that, but it takes a lot of times about a year of working with them to train them about the diet and lifestyle factors and let them fail a couple of times. And, you know, I don't know if we'll have time to get into all of it, but if you're trying to rehabilitate the brain, one thing I will tell you that you absolutely must avoid is gluten. Gluten is extremely inflammatory. I don't care if you have celiac disease. I don't care if you have an allergy or have had a test that shows you're not allergic to gluten. Gluten is extremely inflammatory to the gut lining, and the same tight junction proteins that make up the barrier system of the gut are the same tight junction proteins that make up the blood-brain barrier. And so if you get an inflamed gut and start breaking down the tight junction proteins in the gut lining, you also have a leak and develop what's called leaky gut syndrome. You also have a leaky blood-brain barrier. And if you have a leaky blood-brain barrier, your brain is inflamed. And if you have a stroke or any kind of head trauma, within 24 hours, you will develop a leaky gut.
Mm.
And so a lot of times when I am dealing with a patient who's had a concussion or a stroke or has Alzheimer's, the first thing I'll do is I'll put them on a gut restoration program, which means we eliminate all sugar and inflammatory grains. And for about 8 weeks, we work on, let me back up just a little bit. So our gut is a barrier system, okay? And that our gut lining, if you laid it out, is about the size of a doubles tennis court. That's how much surface area there is. It's only one cell layer thick. And that barrier system is where 70 to 80% of our immune system lives. It's called the gut-associated lymphoid tissue. And that GALT, or gut-associated lymphoid tissue, within our immune system, where 70 to 80% of our immune system is, relies on having trillions and trillions of good bacteria there to help keep the other bad guys. We all have some yeast, some parasites, some E. coli in our gut all the time. But ordinarily, we have trillions and trillions of good guys that keep the other guys in check. You follow me?
Mm-hmm.
Okay. But if you have a head injury or a stroke, or you eat the standard American diet, or you go on antibiotics, your resistance gets lowered, and then these other opportunistic things overgrow, and that creates a leaky gut. Okay. Mm-hmm. I would say probably 70 to 80% of Americans walking around with no symptoms have some sort of leaky gut syndrome, somewhere on that spectrum. And if you've had a head injury or a stroke, I guarantee you've got some leaky gut, unless you've done a great deal of work on with someone who knows what they're doing on gut rehabilitation. So functional medicine, one of the different aspects of functional medicine is, we ask the vital question a few other doctors ask is, why do you have this problem in the first place with the stroke? I mean, it's kind of obvious why you have the problem, but if someone comes in with autoimmune disorder or something like that, it's like, my first question is, after I have the diagnosis, is why? What caused this autoimmune disorder? And then it's like, why did this start? Okay, well, maybe it's because they were overeating Twinkies or they were on prescription antibiotics for long term, or they were on proton pump inhibitors, which inhibit the hydrochloric acid of the stomach, or any number of things. So we keep asking why until we get to the root causes, so we can pluck the problem out at the root. Does that make sense?
Yes.
Okay. So we're interested in why your body lost function in the first place, and how do we restore function and balance? So the difference between functional medicine and conventional medicine, allopathic acute care medicine, is we really believe that the body can heal itself from just about anything if it's given the right impetus, input. Okay. So functional medicine operates on the principle that, identifying the disease state and then forming a diagnosis is not the conclusion, it's just the beginning. Really, to arrive at a deeper understanding takes time and investment that is central to uncovering and resolving the root causes of chronic complex illness. Because there's usually about 6 different things that are involved in perpetuating any complex chronic illness. There's usually inflammation. There's usually gut dysbiosis, like we talked about, where the good guys dwindle and the bad guys kind of overgrow, and there's some level of dysbiosis in that gut-associated lymphoid tissue. So inflammation, gut dysbiosis, lack of critical micro and macronutrients, whether that be vitamin A or D or C or trace minerals that your body absolutely requires for repair and regeneration. Essential fatty acid metabolism is another one. Anemia of any kind, whether it be macrocytic or microcytic anemia, because if your body can't carry oxygen to the tissue cell, you can't heal. Sleep and sleep quality is another huge one. And then looking at different what we call trophic factors, which are hormones and neurotransmitters. Those are the growth factors that have to be just right for the brain to heal, or for your hypothalamus, pituitary, thyroid, adrenal, gonad, so ovary in female or testes in male, for that endocrine system to, it works on a very complex feedback loop. If those hormones are off, you can't repair or regenerate either. And, so if someone has a stroke and they're also in menopause, or they were put into surgical menopause very abruptly, and a female's hormones go into the toilet, she does not have the growth factors, hormones, estrogen, progesterone, to be able to heal the brain, because those are important trophic factors for healing the brain. This is just kind of I threw this in here. My website, if after this Zoom meeting, if any of you want to look me up, or if you would like to come in and work with me as a patient, this is my website, the Center for Functional Medicine. I've got a link at the end.
Dr. Hanes,
Yes.
could you look at the top of your Zoom meeting to see if there's people wanting in? I'm getting some text.
Okay.
Maybe not. I'm sorry to bother you with that. Don't see it.
Okay. Admit.
Thank you. Appreciate that.
There were 2 there.
Okay. Appreciate that very much.
Yeah.
Sorry to interrupt you.
No worries.
Dr. Hanes, you're located where in Colorado?
No, Prineville, Oregon.
Prineville, Oregon. Thank you.
Go ahead, sir. I'm sorry.
Uh-oh, now my slide's locked. Oh, nope, there we go.
Oh, thank you.
Okay.
And just so you know, I'm going to be posting all your information on our post too, so everybody will get that.
So when this is a PET scan, so looking at it's a type of imaging where we can kind of see different parts of the brain light up. This shows like when neurons die, the lights go out. So here's a normal brain. Here's an Alzheimer's brain. Okay.
Wow.
So getting into some of the root causes of why the brain might not, we have to look at diet, things that influence the stress response, nerve growth factors, and neurogenesis, which means new nerve growth. So we need a diet that provides antioxidant defenses and contribute. We need to look at things that can contribute to oxidative stress. When I talk about oxidative stress, you probably all have heard of antioxidants, things like your vitamin E and C, and your carotenoids, bioflavonoids. Those are all antioxidants. There are certain things that we can eat that are very pro-oxidative. So when we think about oxidation, think about when you put a piece of iron out in the weather, it rusts. Well, that's oxidation, and oxidation happens to us at a cellular level. So we need antioxidants, which are very high in your darkly pigmented fruits and vegetables. That's why things like blueberries, organic blueberries and raspberries and darkly colored greens are such good brain foods. They have what are called polyphenols in them that are very good at helping dampen inflammation and oxidative stress in the brain. Inflammation in the body can contribute to neurodegeneration. One of the biggest contributing factors to inflammation in the body is the standard American diet. If we eat, processed food, or eat out at McDonald's, the hydrogenated fats and fake foods that are in there are very, very pro-inflammatory. And there's no drug, no nutrient, no supplement that will outdo an inflammatory diet and lifestyle. So the big culprits are sugar and trans fatty acids. So I jokingly say that a lot of my patients need an oil change. And what I mean by that is they need to get rid of the junk oils, the seed oils. Canola oil is touted as a health food, and it is not. You want to eat use extra virgin olive oil, highly unprocessed, unrefined, like coconut oil, avocado oil, and eat plenty of high quality fish. But there you got to be a little bit careful with things that, fish that accumulate too much mercury. So you want to stick with your smash fish, which is salmon, mackerel, anchovies, sardines, and herring. Okay. Gut. So how does the brain relate to the gut? So there's a gut-brain connection, and it's critically important because they have a lot of crosstalk between the gut and the brain. And what goes on in your gut and the gut lining is also going on at the blood-brain barrier. So with increased intestinal permeability, another way of saying leaky gut, the blood-brain barrier may also become leaky. So inflammation spreads from the body to the brain and can cause memory problems. And gram-negative bacteria that are common for overgrowing in the gut can release things called lipopolysaccharides, LPS, which can create inflammation at the gut lining and then at the blood-brain barrier. And when the brain becomes inflamed, it turns on the immune system in the brain called the microglial cells. And when you have microglial activation, that's a problem, because brain degeneration is going to continue until you settle that microglial activity down. And the best way to do that is to heal the gut. Improve the healthier the gut, the less inflamed the gut, the more the brain can heal itself. And there's all this crosstalk between the gut and the brain. And so memory can be influenced by the gut microbiota, which means just the microorganisms in the gut and their effect on the inflammation in the gut. Physical activity. You can either burn out or rust out. And so you can sit on the couch and rust out, which a lot of people do, or you can burn out. And for me, I want to go out like a shooting star. So, I want to burn out, and hopefully all of you do too. And the problem, once someone has a major life disruption like a stroke, is really how well that person does a year to 5 years after that stroke is all dependent upon their attitude. That's why Gunner, hey, you're what you said at the beginning here, saying, hey, I'm getting better every day and going to the gym. Good on you, buddy. That kind of attitude, that's the way you've got to tackle this with, and you're going to have setbacks. And you got to just get back on that horse every single day and decide, until I'm 6 feet under, I'm not going to quit. Because as soon as you slow down and think, oh, this is hard, or that, you're doomed. So physical activity, regular exercise, enhances memory and reduces dementia by 38%. But here's a big thing. There's something our brain produces called BDNF, brain-derived neurotropic factor. This is like miracle grow for the brain. And physical fitness, fairly intense physical fitness, okay, really helps your body secrete this BDNF at a high level. But if you're sedentary, forget about it. It's not happening. So this nerve growth factor, you have got to be exercising to get to produce this BDNF. And they've actually shown that you can increase the size of the hippocampus. I think it's somewhere like 25% in 4 to 6 weeks with 3 to 4 times a week exercise. That's huge.
Yeah.
That is absolutely huge. There's no drug, there's nothing on the planet that will do that for you. And exercise is free.
Love it.
Chronic stress. You cannot heal with chronic stress. So one of the other things that I share with my patients, if you are stuck in fight or flight, you know what I mean by fight or flight? We have 2 parts of our nervous system. There's the parasympathetic and the sympathetic. And when you're stuck in sympathetic overdrive, meaning fight or flight, you cannot be in rest, digest, and repair. It's physiologically impossible. So if you're stuck in fight or flight, you are not in rest, digest, and repair, and you cannot repair your brain. So whether it be meditation or taking up a hobby or prayer or all of the above, I recommend whatever you can do to mitigate that stress, and exercise. A hard physical exercise is one of the best stress reducers there are. But when you have excess cortisol and stress hormones, you're chewing up brain tissue. Sleep quality. So our brain has what's called a glymphatic system. It's kind of like our lymphatic system of the rest of our body, but in the brain it's called the glymphatic system. And in order for that glymphatic system to be able to drain the garbage and debris from the brain, you have to get deep quality sleep between 7 to 9 hours a night, as restful as you can. And if you have sleep apnea, do not let it go, and find a way to be able to use your CPAP or BiPAP, whatever you use. Figure it out, because if you don't have good oxygenation to your brain while you're sleeping, your brain will not heal, and it's prematurely degenerating. Toxins. Unfortunately, living on the planet we live on today, we are continually exposed to heavy metals, pesticides, and herbicides. And it's in the clothes we wear, stain resistant and wrinkle resistant fabrics. It's in your couch, and it's in your bed that you sleep on. So really, toxins are a big deal that we're all exposed to on a daily basis. And alcohol, they're now saying that there really is no safe amount of alcohol. And so I tell patients, if you're trying to rehabilitate your brain, and and still trying to drink a couple beers, or even 2 or 3 beers a week, it's not going to happen because it messes with your blood sugar. Excuse me, just say it. Usually I can talk about 100 miles a minute, but I've had a bit of a tickle in my throat. So some of the supplements that are, you know what? Excuse me for just a minute.
You're fine. You're fine. I hope everybody's enjoying this. I certainly am. I mean, it's
Give me 1 minute. I'll be right back.
you bet, bud. This is pretty deep stuff and really getting into it. I've written down about 2 pages of different ideas and questions and stuff. How's everybody doing? Everybody getting some
It's
questions put
interesting.
together?
Really good stuff.
Yeah. Yeah, I think it's really good.
Of course, I love the fact he touched on sleep apnea.
Yeah. Yeah, the one thing for me was well, there's more than one. But anyway. You okay,
That was
Dr.
really-
Coby?
All right.
All right.
So you still see my slides?
Yes.
Okay.
Yep.
So these are some supplements that can be helpful when rehabilitating the brain. They're not really in order of what's best. I would say omega-3s are a no-brainer. What I mean there is fish oil, EPA and DHA from fish oil. And anybody that comes in with Alzheimer's, dementia, stroke, head injury, I will immediately put them on a really high quality fish oil and at least 3 to 4 grams a day. And you want one with high amounts of DHA. Okay. DHEA, this one, number 8 here, that is actually a hormone. It's a precursor hormone. So our body takes cholesterol and makes pregnenolone and then DHEA. So DHEA is kind of an upstream hormone that can go down a couple different pathways and make a lot of our other anti-aging regenerative hormones like testosterone, estradiol, estrone, estriol, progesterone, and cortisol. And we need cortisol, but we need it just at the right amount. But omega-3s are a big one. Vitamin D, and if you haven't had your vitamin D tested, make sure your doctor tests your vitamin D at least once a year. You don't want to be in the adequate level. You want to be in the optimal level, which is between 70 and 90 nanograms per milliliter, to really get the benefits from vitamin D. And what I have found in treating thousands and doing pre and post labs on patients is that oftentimes I need to supplement 5,000 international units a day for months and months to get them into that optimal level.
Wow.
Curcumin or turmeric, also big one. Huperzine, a lot of you probably haven't heard of huperzine, but that's a good one. Acetylcholine, another. Okay. This is kind of to show the gut-brain axis. So the brain has influence on the gut, motility, secretion, nutrient delivery, and microbial balance. And then the gut has influences on the brain because actually the gut produces far more serotonin than the brain does. And so neurotransmitters, a lot of our emotions, stress and anxiety, mood and behavior, we feel as gut feelings, right? But we rely on having a healthy gut to be able to get our micro and macronutrients to influence our brain. So there's this, like I said, constant crosstalk and influence on one another that one wants to keep in mind when trying to rehabilitate the brain. So decreased brain activity after a stroke or head injury creates decreased projections or activations of the vagus nerve. And the vagus nerve has direct projections that go to the intestines and increase that regulate peristalsis, the gut rhythmic gut motions, and also how much the pancreas and the gallbladder squirt their juices into the intestine so that we can digest and assimilate nutrients. And if you don't have good vagal tone activating the intestinal immune system, then you get intestinal impermeability, you get SIBO, small intestinal bacterial overgrowth, or CFO, small intestinal fungal or yeast overgrowth, right? So when we talk about the standard American diet, our diet is really high in inflammatory GMO grains, processed and fried foods, which are high in free radicals. Our diet is generally low in antioxidants and essential fatty acids, which lead to poor blood sugar regulation due to too many sweets and starchy foods. And so, the question is there any wonder why we have so much brain degeneration in this country? Mm. Stress and a sedentary lifestyle kind of rounds out the perfect storm for brain degeneration. And brain degeneration or aging is just a nice way of saying brain degeneration, right? Because
I don't think it's very nice, but
yeah. Things like previous head injury, stroke, autoimmunity, poor circulation all lead to brain degeneration. And there are many signs of subtle brain degeneration. You can have trouble learning, loss of passion or motivation, loss of or ability to enjoy your hobbies, decreased sense of smell or balance, get lost easy or trouble with directions. These are all signs of the brain degenerating. When a patient comes in to me and I'm going to work with them on, let's say they come in with Alzheimer's or Parkinson's or after a stroke, most all physicians, they're going to do some basic labs, a CBC, a chem screen, but I will do much more extensive labs looking at a full iron and anemia profile, look at their vitamin D. I'll do a full thyroid panel, and oftentimes we'll look at different autoimmune antibodies to see if the person may have any kind of underlying autoimmunity, because that's extremely common and oftentimes missed. We'll check what's called a CHRP, CRP, high sensitivity CRP, which is for inflammation. We'll look at all their hormones because, as I said, those are trophic factors or growth factors for brain. We'll do an autoimmune panel, and then we'll also check homocysteine, which is it's a product of protein metabolism that if you have an elevated homocysteine, it's going to be very hard to heal the brain because it causes microvascular inflammation and nicks in the blood vessels. Mm-hmm. So I often tell patients the reason we do such extensive labs when I start with them is because I want to have a good, accurate map of their metabolic terrain. So I know where the landmines are. Because once we have a good, accurate map of their metabolic terrain and know where the landmines are and know what their micro and macronutrient deficiencies are, then I have a good roadmap of how we help them heal and repair. A couple things about exercise. Neurons in the brain must be fired and stimulated constantly or they die. So that's why activity is so critically important. Movement and learning new activities. Dance is a great, square dancing or learning to, finding a dance partner and going learning a new dance step. That is one of the very best things you can do for your brain. Because the biggest input to your brain is gravity and mechanoreceptors from your joints. So every single muscle and joint has thousands and thousands of mechanoreceptors that feed back to the cerebellum, which is the small spaghetti-looking part of the brain that hangs down the back. And your cerebellum, I'm going to grab another cough drop here. Your cerebellum, I thought I grabbed you. Maybe not. Oh, there we go. So your cerebellum, even though it's about a third of the mass of the brain, contains over 50% of the neurons. And so anything you do to stimulate mechanoreceptors along the spine or in your joints fires that cerebellum, which then the same side cerebellum. So if I'm waving my left hand, it's my left cerebellum that's doing that. But the way the brain's wired, the left cerebellum fires to the right cortex and the right cerebellum fires to the left cortex. Okay. So if I'm moving my left hand, that is left cerebellum, right cortex that are doing that. So the more we can activate the cerebellum, the more we can light up the rest of the brain. And the more the two hemispheres of the brain make connections between the two hemispheres through something called the diencephalon, which gives you more access to your overall creativity and cognition. Okay. So the cerebellum is the biggest input to the frontal lobes and the rest of the brain, cortex. So for the brain, it's all about BDNF, brain-derived neurotropic factor. And it's a growth factor needed for neuroplasticity, meaning for your brain to grow and create new connections. And it only takes about 3 to 5 minutes of intense exercise with your heart at 70% of max to create some BDNF. But then once it's produced, you must do something new with it. So you want to do a new brain puzzle or learn a new dance step or learn how to play the guitar or, any kind of musical instrument, picking up any kind of musical instrument or dance where you're crossing over the midline with your extremities is really good for helping rehabilitate the brain. So once that BDNF is produced, you must do something with it to create new connections. We talked a little bit about inflammation. It's at the root cause of all chronic degenerative conditions. So inflammatory cytokines, things like IL-6, IL-17, and others damage the lining of the gut and blood-brain barrier and chew up brain tissue. Okay.
And oxidative stress.
And oxidative stress. So if you're gonna, if you are not getting blood to the tips of your fingers, toes, and nose, so if you get cold at the tips of your fingers, nose, or toes, you don't have good perfusion. You don't have good perfusion to the distal tips of your toes, nose, and fingers. You aren't getting good perfusion to your brain. And I don't care what a pulse oximeter, a finger pulse oximeter, I don't care what it reads. If you get cold at the tips of your fingers, toes, and nose, you do not have good perfusion. Okay. So we look at things like anemia and we look at things like nitric oxide. And how do we produce more nitric oxide? Because that nitric oxide opens up blood vessels to get more oxygenated blood to the tissue cell. So low blood pressure can be a problem. So if you get faint when you get up too quickly, or if you get too hot, you want to think about, low blood pressure. Maybe there's times when you have high blood pressure and other times when your blood pressure is too low. That's another thing is, I oftentimes think that medicine over treats high blood pressure and tries to artificially lower it too much, because after the 5th decade of life, you need to allow that pump pressure to go up a little bit because the arteries become stiffer. And if you artificially lower the blood pressure too much, you're not going to get blood out to the distal tips of the fingers, toes, and nose. Therefore, you're not going to get it to the small blood vessels of the brain, heart, and kidneys. You follow me? So I think a lot of times blood pressure medications need to be monitored such that we're not targeting after 60 years of age, trying to get everybody down below 120/80. We need to allow a little bit higher blood pressure with each decade of life because the arteries become more stiff. So the brain consumes 30% to 40% of your glucose, and your brain will tell you how your blood sugar is doing. So if you're sleepy after eating, you're hyperglycemic. You've eaten too much. If your energy gets better after eating, then you may have what's called reactive hypoglycemia. And when you have that kind of hypoglycemia, usually it's because you're overeating refined carbs and your body is not good at producing ketones to mobilize fat stores to keep your blood sugar stable. So in order for the brain to heal and repair, your blood sugar must be absolutely stable. So optimizing brain function, must get 8 hours of quality sleep a night. If you're dehydrated, so is your brain. So I tell patients we're made up of like 60 trillion cells, and those cells can either look like a raisin or a grape. And that includes your brain cells or your muscle cells or your heart cells. So, you want to think about that. Does your brain cells look like a raisin or a grape? Because if your chronic dehydration is the #1 nutrient deficiency, bar none. So, exercise, we want to exercise at least 3 times a week and get at least 3 to 5 minutes of that high intensity exercise for the brain derived neurotropic factor. We want to engage in new and challenging activities. Just kind of comparing the medical model to the model we use in my office. The medical model, they oftentimes treat lab tests. So, if your thyroid TSH was thyroid stimulating hormone, someone with hypothyroidism, they'll titrate the thyroid hormone until that TSH comes in the normal range. But a lot of times that TSH will come into the normal range, but the person still has, cold intolerance or constipation. So you got to look at the patient, not just the lab tests, and see how they're responding, because some patients may need more or you may be over medicating them. So the other problem with traditional medical model is the treatment's always the same. It's always drugs or surgery. Drug it, poison it, or cut it out. And medicine's very compartmentalized. So, you have an EENT, a gastroenterologist, cardiologist, and oncologist, and they all have their very little narrow focus. But no one's trained about how all the other systems work together. And that's where someone like myself, I'm purposely a very good generalist not a specialist, because I want to know how everything relates to everything else. If I didn't know how the gut related to the brain, I wouldn't be able to help rehabilitate a lot of the patients that I rehabilitate with serious problems. So the big thing with medicine is no one asking, a lot of in medicine, they're not asking why the brain is failing in the first place. They use standardized cognitive tests to rule in or rule out dementia, but those tests aren't really meant to catch people with early signs, dementia or Alzheimer's. It's usually pretty late in the progression when the person's already, forgetting where they put their keys or not remembering family members' names. So with our model, the way I take care of patients in my office, we treat the person, not the condition, and really look at the individual, because I can have 10 or 100 diabetes patients come in and they all have the same diagnosis, but how I treat them and how they may develop the diabetes may be 100 different ways that they develop that diabetes. And for me to understand how to unravel that, I got to understand how they got there in the first place. So I look very, I do, like I said, a 2-hour exam when I deal with functional medicine patients. So I really get to know them, because I want to know when their health started going haywire, what was going on in their life? Were they taking care of a sick loved one and stressed out for a year? Were they, did their spouse have a stroke and they were taking care of them, and financial stress and taking care of them was, up here for a year? Or did they have a head injury, or were they on prescription antibiotics for a long period of time? I want to know what was going on when their problems started, because then I understand how do I reverse engineer this and get to the root cause of the problem. So we determine the mechanisms why the body's not functioning right, and then we unravel the whole web. Okay. Because with complex chronic disease, it's not one problem. It's a whole lot of what I call small hinges that swing big metabolic doors. So if you have a little bit of anemia, and you have a little bit of inflammation, and you have some macronutrient deficiencies, those little things are like tiny hinges that swing huge doors, and you add up 1, 2, or 3 of them, and those become great big things that can either cause complex chronic disease or keep it perpetuating, right? So, but those small hinges,
That's where I've been the last
uh,
2 years, probably.
a little bit of anemia, or vitamin D deficiency or magnesium deficiency, you only have to add 2 or 3 of those little things together to equal up to one huge thing. Okay, does that make sense?
Yes.
So putting it all together,
Mhm.
there is no magic pill, potion, or supplement. You must start with regulating blood sugar, making sure the brain's getting good oxygenation and perfusion, make sure it's getting plenty of activation in the form of learning new activities and movement to get lasting results. And when it comes to functional medicine, the kind of medicine I do, my approach does not fix everybody either, but everybody who comes in and does what I ask them to do and avoids the things that I ask them not to, everybody benefits. Whereas you go to medicine and get a diagnosis and you get a prescription medication, not everybody benefits, and many people actually do worse. So when you treat root cause and you really work with the patient to treat, work on diet and lifestyle factors that are what perpetuates most of these chronic diseases, patients get better. The body's designed to be self-healing and self-regulating. God didn't create any junk. We just screwed up with diet.
Good to hear.
Yeah. Well,
So
Hmm.
this is one of those things I told you we check for in my office is homocysteine. And homocysteine is a marker of early brain degeneration. And it's kind of a surrogate marker for B12 and methylated folate, how well you're methylating your B vitamins. So if you have elevated homocysteine, you don't have good ability to methylate your B vitamins, and it causes premature brain degeneration. Those of you who are on this call, some or most of you have had a stroke, so I don't have to tell you. Quality of life is determined by the quality of brain health, and as brain health goes down, quality of health, your life goes down. So, one of the things I like to say is, when you move, you groove. Okay. Our brain is constantly creating new pathways, new grooves. Okay. But only if you move. So if you're learning new dance steps, you're learning how to play a new song on your piano, you're learning new complex motor activities, your brain is laying down all kinds of new neurons and new tracks. If you're sedentary, it's like someone's coming in there with cleavers and cleaving all kinds of nerve connections. So again, you can rust out or you can burn out. So the other thing is, you want to be learning new information, and to learn new information, you want to tie it together with an emotion, right? So when I do these talks, I always try to use some humor and things to trigger an emotion in people, because that's how you create long-term memory. If you are learning something and you're only halfway engaged and you're kind of like ho hum, you're never going to learn it. If you get something like a smell that you really, really love, or that you really, really hate, and you sniff that while you're learning something, or if you intensify your emotions, those two things, smells that you really, really love or that you really, really hate, or elevating your emotions, help you create new grooves in the brain as well. So whenever you're dealing with complex stuff, especially with the brain, you must have support. And the more brain impairment, the more important. And please remember, you must also support the support person, because when someone has a stroke and then the spouse is taking care of that person, who's taking care of them?
exactly.
Right? You got to support the support person.
Yeah.
So, can't improve if you go home to negative Ned or Nelly. So if sometimes I jokingly say I'm treating the wrong patient. The patient comes in and they want to get well, but they go home and the spouse doesn't want to change their diet or lifestyle. So they're saying, why are you making me eat this crap? Or, why are you going to that doctor who's not a neurologist? Or why are you doing, spending this money on this supplement? When you go home to negative Ned or Nelly, going to be very hard to recover.
Yeah.
So healthy relationships, we focus a lot in my office on nutrition and diet, but we also focus on healthy relationships and avoiding toxic relationships. Relating well at home and work is imperative in any kind of complex chronic disease. Sleep, one of the most significantly overlooked factors. You have to have healthy sleep to regenerate. Find something every day that makes you happy, gives you joy, and makes you smile, right? That's really the juice of life. And if you're not getting that juice of life, the brain is withering on the vine. So get out there, enjoy the sun, eat a diversity of plants and plant-based fibers, because many different highly colored fruits and vegetables and in their purest form, organic if you can get it or afford it, really feeds that gut microbiome And remember that as you move, so you groove.
Thank you so much.
So just to kind of close, it's your life, your health, and your choice. Please realize there's no pill, potion, or wonder drug that I or anybody else has, and you must be accountable for yourself and your own health, and be willing to make serious changes, and decide: are you interested or are you committed? Because you guys log in and plug into these programs that Keith does, but you can come in with saying, well, that was interesting. Or you can come in and say, man, that's interesting. And I'm going to jump in with both feet and I'm going to incorporate one or two things here. And so we have what I call a peak brain program, where we do a brain function assessment when we really work on focus, recall, brain endurance, brain fluidity.
I feel fun.
Give different tools and tips, lifestyle and nutritional support. And me and my staff are here to be a community resource. So my functional medicine website too, right here, center 4 functionalmedicine.com. There's a ton of free information on there, and we're here to be a resource. So even if you're not a patient and you want if you think of a question or something, reach out to my staff, and it may take me a few days to get back to you, but we're here to be a resource and love on you and support you in any way we can. So with that, I will kind of end my slide presentation, and let me turn it back over to Keith, and just be here to answer any questions.
Thank you so much, Dr. Hanes. That was awesome. I mean, it was a lot more information than was expected, and I think we all enjoyed it to the fullest. I'm not kidding you. We are running a little late, but I want to ask a few questions that were posted while you were talking that are really important. And so if it's all right with everybody, I'm going to kind of take over and ask him these questions, and then we're going to wrap up today. But I want to make sure, and I will make sure that when we send this out, that the information is there so that you can get a hold of Dr. Hanes and his business and all of that. It's very important. It was an incredible message. I'm not kidding you. And we thank you so much for that, Dr. Hanes. But
My pleasure.
Real quick, what is the safest amount of vitamin D that a person can take daily?
Oh, I would say, first of all, get with, if not your primary care physician, get with a good functional medicine doc or naturopath, or chiropractor who does a lot of brain stuff, and have them test your blood, find out where you're at.
Okay.
So if you are, deficient, I would start at 15,000 international units. But when you take that high a level, you want really high quality, and it needs to be paired with vitamin A and vitamin K2. Okay. Because vitamin K2,
Don't forget.
the only real concern with taking too much vitamin D, particularly vitamin D3. So the prescription ones, they use, it's like 50,000 international units, and you take one pill a week. I would not advise doing that. The prescription ones, that's not what you would, it's vitamin D2, so it's not the best form, and it's at a super high dose. And it's not combined with the other nutrients. So I would not do the prescription ones at all. You can get really high quality vitamin D. And if you want to contact my office, I can share with you what we use. But you can use upwards of 15,000 international units for months and months without any concern at all. The only thing is, I would watch your serum calcium level to make sure your serum calcium doesn't go up. As long as your serum calcium doesn't go up, you can go gas on for a very long time. and make sure you get into that, 70 to 80, 90 nanograms per deciliter for vitamin D level.
Well, I just gonna say this. I think, at least for me, you're talking way over my head when you're saying the things like those levels and stuff. So I'm just gonna mention to everybody, if anybody's like me, you should contact his office and let them help you. Two more quick questions, and then we'll button this up. But so one of our Jim Patterson, who's on here, is a golfer, and he wanted to know if golf is a good form of brain activity and exercise.
If you're walking the course, absolutely. Yep.
Yeah.
If
Okay.
you're in a golf cart, no.
I'm not sure Jimbo wants to hear that.
Yeah.
Good point.
Jim, are you with me, buddy? Well, he'll get the recording even if he's not sitting there. But
Okay.
anyway, very good. Oh, there
I
you go.
gotcha. I'm not sure I like the idea of no cart.
Well, and here's the thing, Dr. Hanes, some of us have some pretty severe, things associated with our stroke, right? I mean, whether it, different kind of, what's the word I'm looking for, Lane?
Cognitive deficit.
No, it's not cognitive. I'm talking about physical. And so we have some physical ailments, and that
Mobility.
mobility.
Gross motor.
Yeah, those can be a deterrent, but still, I hear what you're saying, and I think, and as you were saying all this and telling your having your presentation, I noticed that, and I was thinking about all these people sitting here. We can still get exercise. I mean, whether it's going to the PT or whatever, there's still a way to get it done. So anyway,
Yeah. And so even with gross motor deficits and so forth, there's, I don't care if you get in the swimming pool. I don't care if you take a dance class. You have got to move your body.
yeah,
So think of your brain kind of like one of those kinetic watches that winds itself with movement.
yeah.
Our brain winds itself with movement. And if you're not moving, you're not grooving.
That's awesome. I love that analogy. That was very good. The last thing was, let's see, I put any advice on antidepressants and brain health.
So, there's been a big study that just came out that said, Sarah, has shown that many of these prescription antidepressants do not work any better than placebo. And that depression is not a serotonin deficiency. It's not a chemical imbalance. There was an interesting study where they used an anti-inflammatory. I think it was just like aspirin. And the anti-inflammatory did better than the prescription antidepressant drugs. Now, I would not recommend doing any kind of non-steroidal anti-inflammatory drug long-term. There are other healthier anti-inflammatories like turmeric or curcumin that you can do. And there are many others that work as a natural anti-inflammatory. So, and the other thing I'll say, and I know I sound like a broken record, the number one best thing for depression is exercise.
Exercise. That's
So-
right. And
So
help.
exercise, fish oil, and some like turmeric, those things all would be helpful for depression. But when I work with someone and they mention depression or anxiety is a big part of their symptom picture, I will oftentimes will begin with just about everybody working on healing the gut. And as I said, your gut produces 3 to 4 times as much serotonin as your brain. And so, so you have an enteric nervous system in the gut that has as many neurons as your brain. And so, gut health and brain health are really a two-way street. So heal the gut, optimize vitamin D, get on some really good quality fish oil, move and groove. Yep.
Love it. Love it. Thank you so much. I'll tell you, I got all these thoughts and I know everybody's having them. We're quite a bit over our time and we're so appreciative of Dr. Hanes. I mean, that was an incredible presentation and we just want to thank you so much for that. I personally want to thank you for coming on here and sharing everything that you've shared. It's been amazing. And Diane, thanks for mentioning Dr. Hanes to us. It's just been fabulous. And we will follow up. If there are other questions or anything, you guys can reach out to me, Keith, at strengthafterstroke.com. And we will get answers for you. We're all in this together. And we love everybody here. Couple quick things. There's, our new comic books are out. The new paper is out. I mean, there's a ton going on, and I would just ask for you guys to look at strokeawarenessoregon.org and look around. And if you can donate, we would love it. So with all of that, thank you so much, everybody. Dr. Hanes, let's.
You know what? Thank you.
Yeah, we really, I'm not kidding. I really appreciate you so much. It was very awesome. So
I love teaching and I'd be happy to come back anytime. So.
Oh, great. Yes.
Thank you.
All right.
All right.
Well, everybody
Bye,
have a
everyone.
great rest of the week and we will talk soon.
I just want to say that everything the doctor said is my regimen, basically, and everything. I am the most improved patient my neurologist has had his an entire career.
Yes.
And I keep improving after 7 years.
Mhm.
I'm getting better even this last week. And everything he's saying, every single thing he's saying is correct. And I get my everything checked out. I was vitamin D deficient. I was magnesium deficient. I take supplements for those things. Everything is a balance. It's not one pill that's going to take care of you. It's a holistic approach to the whole thing. And you got to understand exercise is such an important part of that. And so is sleep. I wear a CPAP at night, but I'm sleeping 7 hours straight versus an hour or two right after I had my strokes. So, I mean, everything's an improvement as long as you keep pushing, as long as you keep getting that effort in there and doing what this doctor is saying is everything correct that works and has worked for me.
That's awesome, Gunnar. And you are seriously, bud, you are a shining star. I'm not kidding. You've made so much progress and we appreciate having you on here. So we do need to wrap it up and let everybody go. So thank you, Dr. Hanes.
You're
so
very
much.
welcome.
Thank you
Let
so
everybody
much.
go, and we'll see
Thank
you
you.
guys all soon. Bye-bye.
Thank you.